Visible my screen?
Yes.
Now again we will come to the point, that is cardiovascular system. In that we will see the blood circulation. Now we know the blood circulation, significance of blood circulation. So 4 types of the circulations are there. Which of those we are going to see? That is the pulmonary circulation, systemic circulation, portal circulation, and coronary circulation. Okay. So blood circulation, why it is necessary? Because of the blood circulation, the body will get the pure oxygen, nutrients, hormones, all the material which are useful for the body, and removes the carbon dioxide and the other metabolic waste. Okay. So blood circulation, we will see the types of the blood circulation. Pulmonary circulation, that is the circulation between the heart and the lungs. The circulation between the heart and the lung is called as a pulmonary circulation. In detail, we will see. And the systemic circulation means what? The circulation between the heart and the body. Heart and the body organs, except the lungs. Except the lungs is called as a systemic circulation. And the portal circulation, the circulation between the digestive system, that is nutrient rich blood from the gut and the liver, that is the blood between the GI system and the liver. It is called as a portal circulation. It is called as a portal circulation. Now we will see the coronary circulation. 1 minute. Now see here, the coronary circulation. Coronary circulation means what? See, before I discussed this one, coronary sinus, isn't it? So here it will come. So what do you mean by the coronary sinus and what do you mean by the coronary circulation? The circulation between the blood and the blood vessels of the heart that supplies to the heart, that is the myocardium, that is the coronary arteries, isn't it? That coronary arteries supply the oxygenated blood to the heart muscle, and that coronary veins which drains the deoxygenated blood through the coronary sinus, and that coronary sinus that opens into the right auricle, that opens into the right auricle. That is the coronary circulation, means the circulation in the myocardium only. The circulation of blood in the blood vessels that supplies the heart, that supplies the myocardium. That is the coronary circulation. Okay, understood this one? Now we will see in detail one by one. That is the first one, we will see the pulmonary circulation. Pulmonary circulation, pulmonary means what? The circulation between the heart and the lungs. Means you know the conduction system now. So how it regulates? So the circulation of the blood from the heart to the lung and from lung to the heart, that is called as a pulmonary circulation. That is called as a See now here, the deoxygenated, now see here carefully, the pulmonary circulation. This is the circulation of the blood from the right ventricle of the heart. Right ventricle of the heart to the lungs. The right ventricle contains which type of the blood? Which type of the blood? Are you sleeping or what? Are you conscious? Tell, give me the answer. Right ventricle, it receives having which type of the blood? Oxygenated or deoxygenated? All are keeping mum. Getting or not getting? See, communication, we have the time period, not having that much time, limitation of the time. That's why we are here. Are you getting? Naina ma'am. See, this is the circulation of the blood from the right vein. Am I audible, all of you?
Yes, ma'am.
Yes, ma'am.
Then are you sleeping or what? Are
Yes,
you
ma'am.
getting or not getting? Are you understanding?
Yes,
Yes,
ma'am.
Yes, ma'am.
Why not you are answering? If you are face to face, I will question to you people, isn't it? But this is the online. So are you getting? Are you understanding properly? Or otherwise the no use of arranging the lecture? Isn't it? Or going over 10 feet from your head? See, listen carefully. Pulmonary circulation means it is the circulation of the blood from the right ventricle of the heart to the lungs via which blood vessel? That is the pulmonary artery. And that divides into the fifth thoracic vertebra into right and left, and that will reaches to the right and left lungs and back into the left atrium that is connected to the left atrium and receives the left atrium the oxygenated blood. How it is now? It is full of oxygen. That is, it removes the carbon dioxide, it excretes the carbon dioxide in the lungs and gets the pure oxygen from the lungs. Means pulmonary artery carries the deoxygenated blood into the lungs where it excreted the carbon dioxide and absorbs the oxygen and then comes via the pulmonary vein and it drains their contents into the left atrium. Okay, that is oxygen rich blood. Okay, that is the oxygenated blood. The deoxygenated blood from the right ventricle is forced into the pulmonary artery. That pulmonary artery carries the deoxygenated blood and it enters into the right and left of the lungs and receives the oxygenated blood and again come to the left auricle, that is the left auricle via pulmonary vein. Okay, the left pulmonary artery passes. This is again the same repeated one. Within the lung, these arteries where the exchange of gases takes place mainly in the alveoli and the blood capillaries, where the real exchange of gases takes place in the blood capillary and the alveoli of the lungs, where the exchange of gases takes place. Are you mute yourself? All of you mute yourself, please. If you don't want to join, please leave the meet. If you have interesting, then only you enter. Otherwise, no use of communication. Don't disturb the others. The two pulmonary veins leave each other the lungs, returning the oxygenated blood to the left auricle of the heart. And during the atrial systole, now see here, this is means from the right ventricle to the lung and from the lungs to the right, from the lungs to the left auricle. That is, that circulation is called as a pulmonary circulation. From the heart to the lungs to the heart, that is the pulmonary circulation. Okay, means right ventricle to the lungs and from the lungs to the left auricle, that is the pulmonary circulation. Is that clear to you? Now we will see the systemic circulation. Now we will see the systemic circulation. Circulation means what? The course of the blood from, see here, how it is systemic circulation from heart to the body organs. From heart to the body organs, that is the systemic circulation. Means from the left ventricle to the aorta, and from aorta to the all over the body, and from all over body to the right auricle, that is the systemic circulation. See here the diagram so that you can understand this one. Okay, the general circulation or systemic circulation means what? This from the left ventricle to the aorta, oxygenated blood, from aorta to the all over the body, and from all over body, the deoxygenated blood, again it collects from the superior and inferior vena cava, and then again it drops into the right auricle, that is the general circulation, that is the systemic circulation. And pulmonary circulation means what? From the right ventricle to the this pulmonary artery, and pulmonary artery gives the blood, drops the blood into the lungs, where it get purified, oxygenated, and then again it oxygenated blood come via the pulmonary vein into the left auricle, that is the pulmonary circulation. This is all about the systemic and pulmonary circulation. Now see here the coronary circulation. Coronary, that is coronary circulation, is the circulation of the blood in the blood vessels that supplies the heart muscle, that is the myocardium. Means the circulation of blood in the blood vessels and the heart, that is the coronary circulation. See here the big artery, that is the aorta, and then it is branches, that is the right coronary artery, left coronary artery, the capillaries, the branches, that is the capillaries again rejoin, and the blood it opens into the coronary sinus. It opens these veins, again it join to form the coronary sinus. Are you getting this one? This among the heart only, in the myocardium only, in the heart only, that is the coronary circulation. The cardiac muscles of the heart receives the oxygenated blood from the coronary arteries, and the deoxygenated blood is collected by the coronary vessels and rejoin If you are interested, then only sit, otherwise leave the meeting. Don't disturb. This is all about the coronary circulation. Now see the portal circulation. Now portal circulation means what? The circulation in the from the digestive system to the liver. The circulation in between the digestive system and the liver, it is called as the portal circulation. This circulation of the nutrient-rich blood between the gut. Gut means what? The GI system, gastrointestinal tract and the related organs. And the liver, it is known as the portal circulation. Veins coming from the stomach, intestine, spleen, and pancreas merge into the portal vein. Okay, these all blood coming from the stomach, intestine, the spleen, pancreas merge into the portal vein. That vein, it is called as a portal vein, which then branches into the smaller veins, into the smaller vessels, and that will enter into the liver, and that will enter into the liver. Okay. The portal vein drains. This portal veins contains what type of the blood? Coming from the stomach, intestine, spleen, means it contains all the nutrient material, useful as well as non-useful. Okay, useful with nutrient, with hormonal rich, isn't it? Everything useful as well as non-useful that enter into the portal vein, and that portal vein enters into the liver. Okay, the liver is having two types, that is double blood supply, that is oxygenated also and non-oxygenated also, that is the deoxygenated also. The right and left arteries carries the right and left hepatic artery carries the oxygenated blood, and the portal vein carries the venous blood, that is the deoxygenated blood from the GI tract to the liver, from the GI tract to the liver. The portal venous blood contains, that is the portal deoxygenated blood contains, that is coming from the digestion products, that is coming from the stomach, intestine, isn't it, spleen, that is coming from the GI tract, contains useful and non-useful products, are processed in the liver before being either relaxed back into the hepatic veins. Okay, all these are processed in the liver and then joined together, and that opens into the inferior vena cava, and that inferior vena cava, it enters into the right auricle. Okay, right auricle means in general the portal circulation means what? Portal circulation means what? The blood from the gut to the liver. From the gut means what? Stomach, intestine, spleen, pancreas, everything that is the nutrient rich blood, as well as the useful and non-useful products are also there that are processed via liver. These carries the blood via the portal vein, and that portal vein opens into the liver, and that liver again it is processed and carries that type of the blood into the inferior vena cava, that is the portal circulation. Okay, here see the diagram. This spleen, stomach, spleen, pancreas, all these collects and forms the portal vein, and that portal vein carries this type of the blood, nutrient rich blood, into the liver, that is the circulation between the gut and the liver, that is the GI system and the liver, that is called as a portal circulation. Are you getting my point? No.
Yes, ma'am.
Yes, ma'am.
I know you are getting bored because whole the day you are seeing, you are learning the CVS. So don't get bored. See, if the heart stops, we will stop, isn't it? So how the heart is working continuously, like that we have to work not only continuous, but a little bit, isn't it? So we are taking in between the gap, 5 minutes, 10 minutes, 1 hour, isn't it? So listen carefully, enjoy the session. Heartbeat and pulse. Now see here, the heartbeat. Heartbeat means what? One heartbeat, that is the one cardiac cycle, it represents the one heartbeat, isn't it? It is similar, both the pulse and the heart rate and pulse, how it is similar, I will explain you. But see here the rhythmic action of the heart, that is the heart beats. Beats, how it beats? Dub, lub, dub, lub. That is the contraction, relaxation, contraction, relaxation. The rhythmic contraction and relaxation of the heart is called as a heartbeat. Okay, the rhythmic contraction and relaxation. Each heartbeat includes one systole, one diastole. That is the contraction and relaxation. Like that, the heart beats per minute. How much? 72 beats per minute. That is the heart rate. Heart rate. Now see here, what do you mean by the stroke volume? What do you mean by the cardiac output? As usual, before only I told you that is the one when the heart beats, the ventricle pumps how much liter of the blood? About 70 ml of the blood. Okay. It pumps about 70 ml of the blood per beat, per cardiac cycle. That is called as the stroke volume. That is called as a stroke volume. Now see, calculate that one. It means about 72 into 70 ml. 72, why 72? Because per minute it beats how many times? 72 times. So one cardiac cycle, 70 ml of the blood. Okay, it pumps 70 ml of the blood. So 72 beats into 70, approximately 5 liters of the blood per minute. That is the cardiac output. That is the cardiac output. Now, according to that rate, it may be sometimes if it is more than the normal, that is tachycardia. If it is low or slow than the normal heart rate, that is the bradycardia. Okay, that is the normal. How much? How much normal? 72. If it is more than the 72, that is tachycardia, and less than the 72, that is the bradycardia. Now see here, the rhythmicity. Rhythm means what? It is the equidistance. It is the similarity of that rhythm. Equidistance, isn't it? So dub, lub, that is the beat, the rhythm, it is the same in equidistance. That is called as a rhythm. That is called as the rhythm of that heart. Okay. So the rhythmic contraction and relaxation of the heart is called as a heartbeat. Okay. Again the same, it will come the components of the conducting system, SA node, AV node, bundle of His, everything it will become same. Okay, rhythmicity we will see here while explaining the pulse. Okay, so that you will understand. Now what do you mean by the pulse? Pulse means we can feel the pulse, isn't it? That is the pressure wave. That is the pressure wave. How usually doctor will measure the pulse? By the radial artery, isn't it? So the pulse is the pressure wave that travels through the arteries which are superficial to that one. After each ventricular systole, the wave we can feel, that wave it is called as the pulse. That is the pressure wave. After each ventricular systole, the pulse may be felt where it will felt by the radial artery surface. Each artery actually, when we will feel anger, when we are become angry, temporal will be increase. Then we can see the temporal artery beating, it will bulge like anything, isn't it? Enlargement of that one, we can see that one. That's why, so when we are angry, the pulse rate will increase. When we fear, that time also the pulse rate will increase, isn't it? When we exercise, that time also the pulse rate will be increased. It is related to the heart, because one beat in every beating, after the ventricular systole, the pulse wave we can feel. Means what? In the cardiac cycle only, isn't it? So after one beat, that is the pulse. So same, pulse rate and heart rate are related to one another. How the heart rates are 72, like that the pulse will also similar. Pulse rate and heart rate are same. The radial artery we can use at the where the location wrist side, isn't it? Commonly we can use for the feeling of the pulse. Okay. Pulse rate is higher in the children, female, in the standing position, and lower in the adults, males, and when in lying in the lying position. Okay, when in lying position. It increases the emotional status such as anger, fear, excitement during exercise. The pulse rate will get increased. Now you will see that while examining the pulse, we can see the features of this one. That is the rate. Rate means what? It means frequency of the pulse per minute. How frequency? We can feel now 1, 2, 3. That is the frequency. That is the rate per minute. That is the rate per minute, pulse rate per minute. And rhythm. Rhythm means what? How we can feel the equidistance. The beats we can feel equidistance. Means fraction of second, the beat will come. Or sometimes, is it happen like that? Sometimes it is suppressed and sometimes it is come. It is not like that, isn't it? So that's why if it will feel like that, that is the disorder. That is the disorder, isn't it? So the rhythm should be proper. The rhythm should be proper. Or sometime it will increase or sometime it will be Spanish. It is not like that, na? It is finished. It is not like that, na? It continuously, it is beating. We can feel that one, continuity. Continuity, that is regularity. It indicates the equidistance of that feeling, that wave feeling. And volume means what? The rise of the pulse, how much it we can feel. We can feel now, how much it will raise, it will be rise, isn't it? The wave, the height of that one, we feel now that one. Sometimes we will not feel the pulse, isn't it? When we are in the which case fall down, sometimes the hypotension. What happens if you will, sometimes you will feel the giddiness. At that time, we will not feel the pulse, the silent wave we can feel, isn't it? So, and normally how we will feel? Normal rise of the pulse wave, that is the good we can feel, that is the volume. That is the diastolic level, above the diastolic level, rise of the pulse wave, how much we are feeling, that is the volume. Tension, that is the pressure, that is the systolic pressure, approximate measurement of the systolic pressure. Now factors affecting gender, male, female, different, isn't it? Female more and male little bit less. Temperature, high altitude, we can feel. So age, according to the age, emotional status, circulating hormones, adrenaline, isn't it? Activity and exercises. If more exercise, we will feel the increase in the pulse rate. Autonomic nerve activity, sympathetic, parasympathetic, isn't it? Then next, the baroreceptor reflex. Now, pathological significance, same as that of the bradycardia and tachycardia, decrease the pulse rate. Tachycardia, that is the increased pulse rate. Okay. Normal values, how much? In the newborn babies, it is higher than the adult one. How much it is? 140 beats per minute. And the 5 years of the children, that is the 100 beats per minute. And in the adult, that is the normally it is 60 to 80 beats per minute. These are the normal values of the pulse rate. Now we will see here, come to the point, that is the next one, that is the blood pressure. We have the time limit, that's why we are little bit fast. Now again, this blood pressure, see here, blood pressure. Pressure means what? Sometimes we feel that I have pressure, isn't it? We feel that too much pressure I have. Means what? That is the tension. That is the tension. Blood pressure means what? The pressure exerted by the blood to the walls of the vessel. That is the blood pressure. Pressure means what? The pressure or the force exerted by the blood to the on the walls of the arteries, that is called as the blood pressure. How much? The blood pressures are of two types: systolic blood pressure, diastolic blood pressure. It is measured That unit is millimeters of mercury, mmHg. It is measured by the apparatus instrument, that is the sphygmomanometer. How much it is? Normally 120 80 mmHg. 120 80 mmHg. Now the blood pressure methods are there. Three types of there. First we will see the systolic, diastolic means what? Systolic, in the layman language we can say that upper side, that is the pressure, वरचा pressure, खालचा pressure, isn't it? It is means what? It is the systolic pressure and the diastolic pressure. Systolic means upper pressure. In layman language we can say that one. Systolic means what? It is more. That is 120 mmHg. It is due to the ventricular systole. It is due to the ventricular systole. And diastolic means what? It is during measured by the ventricular diastole. Relaxation. While relaxation also, if it is more, that is the real pressure here we can say. And the systolic pressure, the factors will affect sometimes. That is what we called. It is not permanent, isn't it? Sometimes if we will feel angry, if we will feel fear, if we will do exercise more, only the systolic pressure will get increased, not the diastolic. Not the diastolic. If it is a diastolic, if it is increasing, then that is the medical emergency. If more, then it is medical emergency, isn't it? So normal diastolic pressure, it is the 80 mmHg. So normally we can tell that it is the blood pressure is 120 80. 120, that is uppermost, that is the systolic, and the 80, that is the lower side, that is the diastolic. It is more important. Okay, now we will see the methods of determination of the blood pressure. How we can measure? In your practical, it is there. Oscillatory method, palpatory method, osculatory method. We are using this method most probably. Okay, the doctors are using the sphygmomanometer, and using this method we are measuring the blood pressure. Okay, now we will see the factors affecting the blood pressure. What are the factors? The age, gender, stress. So don't take the stress every time. Do properly, so no increase in the blood pressure. Diet, salt and the salt related saturated fatty acid, that will increase the BP. So take the food that is sattvic food. Okay, exercise, lack of exercise also increase the BP, and more exercise will also increase the BP. So it should be in the limit. It should be limit. If you will not, you will not do the physical activity, you will become obese, and that obesity will increase your pressure, isn't it? So that is, both are important. Lack and too much. So be in the limit. Be in the limit. Climate, cold at higher in the generally the higher atmospheric, cold atmospheric condition than the hot, it will increase the BP. Smokers, cigarette smokers, high alcoholic, hormones like adrenaline, non-adrenaline, ADH, antidiuretic hormone, that will increase the blood pressure. And the diseases like the diabetes, obesity, atherosclerosis, hyperlipidemia, that will increase the blood pressure. Pheochromocytoma, that will also increase the blood pressure because it releases the adrenaline. Okay, now next one, control of the BP. This is more important. How to control? By two ways: short-term control, long-term control, isn't it? This involves the short-term control involves the baroreceptor reflex, chemoreceptor. Actually, chemoreceptors, these are present in the respiratory. But here, how the respiratory and CVS is related, we will going to see here. And the circulating hormones. And the long-term, that is mainly here we can see the RAS system. That is the renin-angiotensin aldosterone system, that is regulated by the kidneys. How we will going to see in detail. The cardiovascular center is a collection of the interconnected neurons in the brain. In the brain, there is a remote control, and it is situated in the medulla and the pons. Okay, how it will work, we will see. The CVS receives and integrates and coordinates inputs from the baroreceptors, chemoreceptors, and the higher centers in the brain. Means on off switch, on off buttons are there in the brain. Okay, when it will disturb due to the some factors, it will switch on, isn't it? So how it get response like that we will see in detail through the next slide. So baroreceptor, pressure receptors, where it is present, it is located on the walls of the several large systemic arteries. Where it is present in the walls of, and pressure, how it is exerted, the blood exerted the pressure on the walls of the arteries. So baroreceptors are located on the walls. So if it is higher, it will send the signals to the brain, and the brain will give the signals to the baroreceptor how to control that one. So it is controlling. How we will see. See, when the rise in BP, it is there in the arteries, it stimulates the baroreceptor, okay? And increase their input into the cardiovascular center. It will give the signals to the CVC center in the brain. It increases the parasympathetic nerve activity to the heart, because these nerve endings are sensitive to the supplying to these receptors, isn't it? So which type of the nerve activity will increase? Parasympathetic. And parasympathetic will release which type of this one neurotransmitter? Acetylcholine. And what is the role of the acetylcholine? It decreases the heart rate, pulse rate, pressure, and ultimately the pressure. So decreases the heart rate and force of contraction, and that causes the vasodilatation, and that causes the decrease in the blood pressure. Are you getting this point? When rise in the BP, this will happens. Okay, it stimulates the baroreceptor, increases the input into the cardiovascular center, and that increases the parasympathetic nerve activity to the heart, and that acetylcholine releases, it decreases the heart rate, and that causes the vasodilatation and ultimately fall in the blood pressure. And exactly opposite to that one, that is when it is fall in the blood pressure, deactivates the baroreceptor, decreases the input, and increases the here the sympathetic nerve activity will increase. So adrenaline will get released, adrenaline will get released, and that causes the increase in the heart rate and force of contraction, that causes the vasoconstriction, and that will causes the systemic blood pressure. Okay, so like that, the baroreceptor controls the blood pressure. That is called as baroreceptor reflex. That is called as baroreceptor reflex. Are you getting? Now, chemoreceptors. Chemoreceptors, actually, these chemoreceptors are involved in the respiration. But how it is related, we will see. When small change in the environment, when small change in the levels of the hydrogen, carbon dioxide, oxygen, or small change in the pH of the blood, acidity, that will influences the chemoreceptor. And what they causes, when there is small change, that is detected by the chemoreceptor, and that will give signals to the cardiovascular centers, and that will supplies the signals, that will supplies the reflexes, and that causes the stimulation of either sympathetic activity or causes the parasympathetic activity. When there is rise, it releases what? Parasympathetic, and causes the fall in blood pressure. And when there is fall in the BP, that releases the that stimulates the sympathetic activity and stimulates the heart